decision to step down as leader of the state Senate Republican caucus at the end of this term. For as long as we've worked together, Leader Brady has exemplified what it means to advocate for his caucus and pursue common ground, even where it's sometimes hard to find. Together, we brought the bipartisan Rebuild Illinois capital program over the finish line, bringing real change to every community in Illinois, no matter its political stripe. In other words, doing exactly what government is meant to do. So I want to wish Leader Brady all the best as he closes this chapter and steps into the next phase of his career. Moving on to today's COVID update, we again have a grim picture to share and a potentially long effort ahead to get the virus under control in this state. I know there's a lot of focus on other current events right now, but I do want to remind everyone that Illinois and the nation, especially the states making news right now for their role in the presidential election, are in the middle of a public health crisis. And we cannot forget to take the necessary precautions to beat this pandemic down. At the beginning of last month, we were averaging 23 deaths in Illinois to COVID-19 each day on average. That average is now up to 45. The number of Illinoisans in the hospital with COVID-19 has more than doubled in the last month, from an average of about 1,500 to now an average of about 3,300. And compared to just last week, every single one of our 11 regions has seen an increase in the average number of people going into the hospital every day with COVID-19. Also, compared to last week, all 11 regions are seeing severe increases in their positivity rates, ranging from a low of 10.0% in regions 5 and 6, and a high of 15.7% in Region 1, northwestern Illinois. The virus is spreading, and every region of the state is suffering from its insidious, invisible contagion. Make no mistake, this pandemic isn't over, not by a long shot. And it's not enough for us to just know more. We have to act differently. Mitigations that limit public interactions only work if everyone takes some personal responsibility for masking, social distancing, and following the CDC and IDPH guidelines. So please do your part and do what it takes to keep yourself and your families safe. I know that we can find a way through this. Time and again, even when the people of Illinois are set back on our heels, we find a way to move forward. And I'm confident that we, working together, will be able to do that. We will potentially eradicate this virus and return to a normal way of life and help our neighbors who are struggling, but we all must work together to get that done. The same can be said for our state's fiscal situation. For decades before I became governor, Illinois' expenditures never matched its revenues. One of the reasons that I ran for office was to finally tackle our fiscal problems in a responsible way while investing in what makes this state a great place to live, improving our schools, expanding affordable health care, creating a durable social safety net, and making our state run more efficiently, all while living responsibly within our fiscal means. Today, this problem has reached a peak as we in Illinois are racking up more bills than we have in revenues. It's unsustainable. My predecessor, Governor Rauner, tried to drag the state underwater with painful and draconian cuts that in the end were blocked by both Republicans and Democrats. His approach devastated higher education, child care, human services, and hollowed out state agencies like those that manage public health and unemployment benefits, all while adding billions of dollars of debt onto our bill backlog. 2 years without a state budget, longer than any other state in United States history, nearly destroyed the lives of the most vulnerable children and families in Illinois. And it left all of us with an untenable situation. The state's inability to fund education also drove up property taxes that are, frankly, already too high. Illinois has had the lowest percentage of state funding for education in the nation, increasing the gaps between schools in low wealth, high poverty areas and those with abundant resources. And local school districts raised property taxes to make up for the state's failures. When I came into the governorship, I found a backlog of almost $8 billion in unpaid bills. And working with the comptroller, we brought that down by $1 billion in just 12 months. The state had been paying late payment penalties that reached $950 million per year when I became governor. We went to work and we reduced the late payment penalties by about $850 million per year. The point is, we've been reducing waste and inefficiency from day one because of the problem of the state's finances and the fact that those need to be addressed from every angle. And in my first major address as governor nearly 2 years ago, I laid out our 3 paths forward with regard to the budget. Option 1, immediately make billions of dollars in cuts. Let me offer some context to that. Already, the state of Illinois invests, on average, less money per capita than the majority of states. That's not to suggest that we can't find significant cost reductions. We've been doing that. But if you think cutting government alone is the solution, remember this: if you set aside federally protected programs, court-ordered obligations, and our bond and pension debt, we would have to reduce discretionary spending in our state by approximately 15%. That's 15% fewer state troopers. That's 15% fewer students going to college, 15% fewer working parents receiving child care assistance, and 15% less money for your local public schools, which likely means that your property taxes will increase. You could call this the Republican approach. Option 2, raise revenue within our current regressive flat tax system and impose a higher flat tax, which falls disproportionately on the working poor and the middle class. Option 3 was the fair tax, an option that people have talked about in Illinois for decades because few other states use the antiquated flat tax system. And while the fair tax would have helped to address our budget crisis with the least damage to the working families of Illinois, the millionaires and billionaires opposed it to protect their own wallets, deceiving the public about its purpose, and they ended up prevailing. Sometimes politics works against the best solutions. Had the fair tax passed, we would have been on a course toward long-term stabilization of our state's finances, balancing the budget, eliminating the backlog, making our pension payments, and investing in a rainy day fund in a way that would start to unburden the working families of our state. But the opponents of the fair tax lied about what would happen if it passed, and they left all of the working people of Illinois holding the bag. It's no surprise these are the same people who pushed for Bruce Rauner's agenda and will resurrect his failed crusade any way they can. So let me just say to the people of Illinois, you deserved a fairer tax system, and you still do. But that didn't happen. Republicans swore their allegiance to the wealthiest interests in the state, and they threw middle-class families under the bus. So here we are. I have not given up the battle to balance our budget and to put the state on firm fiscal footing. I will work every day to repair the fiscal instability that has been ailing Illinois for more than 3 decades. I will work with the legislature to implement structural solutions to our decades-long budget woes. But I will never forget that some of the wealthiest and most powerful interests in Illinois did everything in their power to put the burden of this on workers and their families instead of shouldering some of the burden themselves. Because this is where we are now. Illinois' fiscal problems haven't gone away. We now sit at a crossroads. Our state finances still require fundamental structural change. In the coming days, I'll be talking with the leaders in the General Assembly about our path forward, but here's what we know for sure. I promised to be a governor who balances the budget and pays the bills that my predecessor left behind. I promised to make sure that our kids get a good education, that we invest in job creation, and that we build a better future for Illinois. There will be cuts, and they will be painful. And the worst thing is, the same billionaires who lied to you about the fair tax are more than happy to hurt our public schools, shake the foundations of our cities, and diminish our state. Maybe because they think it won't hurt them. If they cared about giving your child the best public education available, if they wanted you to be able to afford child care too, if they wanted your elderly parents to be cared for properly, just like their parents are, they wouldn't have fought so hard to avoid paying just a little bit more. People often say that I'm too positive and too optimistic. My optimism comes from the people of this great state and from all of the things that they've endured together over this year. And my optimism has not been shaken. We will get through this. We will get through all of this together. And when you feel yourself losing a bit of hope, I'm always here to offer you some of mine, because I know that the strong character of this state and its people is paramount. And for 2 centuries, it's something that we've always been able to count on through thick and thin. And with that, I'd like to turn it over to Dr. Zike.
Good afternoon, everyone. So I am proud to have been able to participate in our democracy, and I'm so proud that so many people did as well. While votes are still being tallied, let's be clear, whomever is elected or re-elected president does not absolve any one of us from taking personal responsibility to curb the transmission of COVID-19. Again, regardless of the occupants of 600 Pennsylvania Ave, our role is unchanged. So please, let's do our part, and let's encourage one another to do the right thing. Recently, I started rolling down my window at red lights, and I talk to people on the streets who are wearing their masks, and I say, thank you for wearing your mask. It's a really simple measure, but I feel like it's powerful in that it acknowledges the good acts of citizens, which hopefully encourages them to keep it going. I've only gotten smiles and positive responses in the few days that I've been doing this, but I'm asking you to try this with me. It costs absolutely nothing, but it gives a much needed opportunity to positively connect with our neighbors. I'd also like to encourage people who participated in recent campaign rallies, worked in polling places, stood in line to vote where maybe they couldn't maintain the 6 foot of distance, anyone who participated in recent protests or any other recent events, please get tested. Wait approximately 1 week after the high-risk exposure, because it takes several days after exposure for a test to be positive if in fact you've contracted the virus. But if at that 7-day mark the test is negative, remember that it can take up to 14 days to have a positive test. There are 11 state community-based testing sites across Illinois, and our mobile testing teams are dispatched each week to additional locations around the state. Anyone can be tested at these sites. You don't need to have symptoms, you don't have to have insurance, and you don't need an appointment. So if you think you have been exposed to COVID-19, please get tested and quarantine so that you don't spread the virus to others. The virus is spreading rapidly. We are fully into the second wave or second surge, and the cases are increasing exponentially. Today, we are reporting 7,538 new cases for a total of 437,556 cases in Illinois. and that includes 55 additional deaths for a total of 9,933 total lives lost. And among that count includes a 30-year-old. Overnight, 3,761 individuals were reported to be in the hospital with COVID-19, and of those, 776 patients were in the ICU. 327 patients were on ventilators. Our testing numbers continue to be good, with more than 71,000 tests reported since yesterday, for a total of more than 8 million tests in the state. Again, if you have been exposed or think you could have been exposed, please get tested. You can find a listing of our testing sites on the IDPH website by going to dph.illinois.gov. And please help stop the spread of the virus. Wear your mask, wash your hands, and watch your distance. Thank you. Buenas tardes. Me dio mucho orgullo de ver un esfuerzo tan sólido para participar en nuestra democracia. Sí, todavía se están contando los votos, pero déjame ser clara, no importa quién gane, COVID-19 seguirá siendo una amenaza para todos en Illinois. Así que, por favor, hagan lo necesario para reducir la propagación de este virus. Cuando voy manejando, bajo mi ventana para agradecer a la gente que lleva sus máscaras. Es una medida simple, pero es poderoso porque reconoce los buenos actos de las personas. Solo he recibido sonrisas y respuestas positivas en los pocos días que hago eso. ¿Me acompañarás en este acto amable? No cuesta nada y nos da una oportunidad muy necesaria para conectarnos positivamente con nuestros vecinos. Tengo una recomendación para las personas que trabajaron en lugares de votación, hicieron fila para votar, participaron en protestas u otros eventos recientes. Háganse la prueba para COVID-19 en los próximos 6 a 7 días. Por lo general, se necesitan varios días después de la exposición para que una prueba sea positiva si ha contraído el virus. Hay 11 sitios de prueba del estado en Illinois y nuestros equipos de prueba móviles están en diferentes condados cada semana. Cualquier persona puede hacerse la prueba en estos sitios. No es necesario que tenga síntomas, no es necesario que tenga seguro médico y no necesita una cita. Si cree que ha estado expuesto al COVID-19, hágase la prueba y póngase en cuarentena para no transmitir el virus a otras personas. El virus se está propagando rápidamente y los casos aumentan exponencialmente. En las últimas 24 horas, más de 71,000 pruebas fueron hechas para un total de 8 millones de pruebas. Desde anoche, 3,761 personas en Illinois estaban en el hospital con COVID-19 y de ellos 776 pacientes estaban en la unidad de cuidados intensivos y 327 pacientes estaban en ventiladores. Hoy informamos 7,538 nuevos casos de COVID-19 en Illinois, incluidas 55 vidas perdidas y una persona de los años 30. Hasta la fecha se han reportado más de 430,000 casos confirmados en Illinois y casi 10,000 muertes. Por favor, ayuda a detener la propagación del virus. Recuerde los 3 M's. Póngase la máscara, lávese las manos y mantenga la distancia. Y no se olvide, vacunarse contra la influenza. Muchísimas gracias para su apoyo. And with that, I will turn it over to Governor Pritzker.
Thank you, Dr. Ezike. Sorry. Happy to take questions from members of the media. Sarah?
Governor, do you think a lack of trust in state government, specifically Michael Madigan, helped sink the graduated tax amendment?
Look, I think there's enormous distrust in government all the way around. As you know, I proposed ethics reforms. I put forward, the reforms that include removing the revolving door for legislators so they can't just the next day after they leave the legislature become a lobbyist. I put forward the disclosure rules for lobbyists to make sure that we have more disclosure from them, and also disclosure of any relatives of elected officials that serve, for example, that work for our utilities or others who are lobbying state government. We need a lot of change. There's no doubt we need ethics reform. I've been fighting for that. As you know, we had a very short session because of COVID last spring. So I want to bring that back and make sure we get that passed.
So voters were definitely engaged on the graduated income tax. It went down 55% to 45%. In the last 2 days, you said we might not know until Friday. Are you conceding, or are you demanding a recount, or are you going to wait? Or because there's some uncounted mail-in ballots that have yet to be checked.
Well, certainly they should count all the ballots, but I think you heard from the leader of the Yes for Fairness campaign that they don't believe that they'll be able to, overcome with the leftover mail ballots the number of votes against in order to make sure that the fair tax would pass.
And a lot of voters said, why would you punish us for, why would you want to punish voters by raising their taxes, because they did.
Oh, I don't want to do that at all. In fact, as you know, I was fighting to lower their taxes. 97% of people would have had their taxes lowered, despite the lies that the folks on the other side, the billionaires and their special interests, told people online and on TV. The fact is that I want to lower taxes on the middle class. My entire term in office, I've been fighting for middle class families, for making sure that our working families have a voice in Springfield and that they're better off. And that's what the fair tax is about. I also have made it clear from day one that we have a structural budget problem in the state of Illinois, and that needs to be solved, and the fair tax was the best solution among three that I talked about just a few moments ago. But it went down to defeat. I understand the other side told the lies that they told. A lot of people believed that, and that's too bad. And now we're going to have to suffer the pain that they've brought on.
Governor, do you think if you tied it to pension reform or cost-cutting, that may have helped get this thing passed?
Well, we did a lot of cost cutting. I think I was clear about that too. We've done a lot of, we put in place a lot of efficiencies in state government. And the fact is that, the other side wants to take away your retirement income. They're the ones who want to take away your pension. They're the ones who proposed a retirement tax, the other side. But they lied about that on TV too. And so, here we are, and I think, I'm going to continue to fight for working families. I'm going to continue to make sure that we're paying the pensions that are owed to people and that we don't tax retirement income. I will stand foursquare against any tax on retirement.
You sunk, over $54 million of your own money into this. Just what is your reaction that you spent so much money, you campaigned on this, this was your thing, and it fails?
When I fight for something, I go all in. And here I'm fighting for the working families of Illinois. I'm trying to solve the long-term structural issues facing our state, and I'm willing to put my resources forward. I'm willing to put my time, energy, and effort forward. I don't rest. My staff will tell you I'm up at 4 in the morning, texting them, emailing them, because I'm working all the time trying to figure out how to make things better for people across the state. We've done that, by the way. We've made a lot of changes that are good for the people of Illinois. We're facing significant challenges because of COVID, and we already were facing significant fiscal challenges, the ones I inherited from my predecessor and his predecessors. It's been here for 30 years, this structural problem. I came into office, I laid it bare, and I proposed a solution.
We'll do one more in the room.
I had a medical question for Dr. Ezike just regarding hospital bed capacity in the Chicago area. I noticed Region 7 is at 22% med-surg, which is just above 20. Are you hearing of hospitals having to implement changes to ensure bed capacity? Has it gotten to that in the Chicago area?
So we are monitoring, obviously, bed capacity throughout the state. I think our bigger problem right now is in regions 1 through 6. 7 through 11, just again, by virtue of the amount of beds and how close, Region 7 is in proximity to Region 8, there is a lot of room for moving patients around within the Northeast. The significant issue is in Regions 1 through 6. We have had calls for assistance from the state for medical staff. We know of some hospitals that have already slowed down elective surgeries to have beds. So there is a bed issue that's brewing now that's only going to grow. We had 7,500 new cases, and that means that we have future hospitalizations, future needs for ICU beds in a situation where some hospitals are already cramped. So yes, we have a significant problem, and we're going to have to come up with some creative solutions to make sure that everyone has a bed, whether it's for COVID or whether it's for a flu-like illness, whether it's for a car accident, whether it's for a heart attack. But that is a very imminent issue, and we still need to work on the front end to try to limit the number of people who get sick, i.e. the people who get infected in the first place, so that we can slow down that need for hospitalization.
Are you recommending specifically poll workers get a COVID test?
Let's be very clear. There are, depending on what study you look at, I know I looked recently at some college data, Cornell University, they've been doing surveillance testing on their students. They said that 80% of the positives had no symptoms at all. I've seen many other pieces of literature that said, 40 to 60% of people have no symptoms. You can't know if you have COVID or not. So we really need to move away from waiting till you have symptoms to think that that's the time to go get tested. We're working with our teams to increase capacity in the state beyond what we already have. We're already one of the biggest testers in the nation, but we need to continue to expand capacity because we cannot wait for symptoms. We need to be testing on a regular basis. Obviously, if you're in a high-risk setting, where you're around lots of people for hours indoors, that is absolutely a high-risk setting. And yes, I would recommend testing, not wait for symptoms. Wait a couple of days because, like I said, you may be in a high-risk setting and have been exposed, but you won't turn positive for many days, maybe even up to a week, but it can also be up to 14 days. So you just have to be cautious, be aware of that, be very careful, constantly, wearing your mask and being as careful as possible. But yes, I think everyone should get in the habit of getting tested, whether they have symptoms or not, because with this amount of disease in our community, it's hard to think that you could go anywhere and not potentially be exposed.
And Dr. Zeke, are these the 7,538, are those new cases or just positive tests? Because some people retested 2 or 3 times.
Great,
so that they
great
can get
question.
back into...
Those are the new cases. So we have removed, there were more positive tests than that, but we have removed people who have already been confirmed cases. These are new individuals that are being tested, that have tested positive for the first time.
Okay, and is this age group still around 20, 29?
Well, it's all age groups. It's all age groups. The highest group is 20 to 29, but we have people in 0 to 10, 10 to 19, every single age group. When we say 20 to 29 is just a little bit higher than others, that doesn't mean that there aren't people in every single age group that are testing positive every day.
I think that's an excellent question, and I want to clarify for everybody. There was a time when there was a big spike of just the 20 to 29-year-olds, and we all paid a lot of attention to it because it was so unusual that among all of the age groups, here is the the very youngest, essentially adults, testing positive so much. It's no longer the case that they're unusual. That is, if you look across all the age groups. Yes, it's true that 20 to 29-year-olds, more of them are testing positive, but honestly, the difference between that and each of the other age groups, at least near them, is not much.
All right, we'll go to questions online.
Yeah.
This question's for Dr. Ezike. This is from Lauren Petty. Is Illinois seeing a surge in youth cases that the American Academy of Pediatrics has recently warned about? If so, do you think there's a reason for this spike, and what's your message for parents?
Right, so again, when you have this much disease in our community, no one is immune. So whatever the setting is, which is contracted, many people are going to come in contact with many others, and that includes children who do not live in a bubble but live with other people. We have seen a big jump in the pediatric population. They are, I think if you look nationally, for the week that ended 10/31, they had they were the third largest group in terms of the total number of cases. So again, as the governor said, we are seeing ample numbers of cases in every single age group. They are, we talk about 2029, but the 10 to 19 is really driving that pediatric population. And again, they're involved in activities and group things as well. There's sports, there's dance, there's school, there's trick-or-treating, there's birthday parties. So there's ample opportunity for our younger residents to get this infection as well.
And Dr. ZK, one more for you from Chris at NBC. He's wondering how soon we could start to see the positivity rates decline because of the mitigations that we have in some of the regions.
Yeah, so well, of course, that depends on individuals and how well those mitigations are followed. So when we hear about closing these high-risk settings like bars and indoor restaurants, again, the amount of uptake of that activity is going to play into how effective they are. Of course, the individual activity, the personal responsibility, the wearing of masks and limiting these private gatherings, that's key and essential. So again, there are a lot of unknowns in terms of I can't know how much people are following this. I can't be in all the venues to make sure that these events aren't happening, that the bars are closed. But if they are followed, when they are followed, they would be successful. It's going to take longer because the rates are so high. There's so much disease now. But really, if we would just give it a try, we will see that it will work. Ask the people in Region 4 and Region 7. They proved this already. It can work, but we have to have the will to do it.
John O'Connor at the AP. Governor, you linked full education funding to amendment approval, just like Browner did in 17 with the grand bargain. So now you have a deeper hole. Was that wise? What will you do to fully fund schools now?
I think that's not accurate. I have certainly linked education funding to the failure of revenues and the failure to fill the revenue hole that is the structural budget deficit of the state. And so I'm going to fight to make sure that we don't have cuts to education. That's one of the most important investments that you can make, honestly, in a state. When you look at all the ways in which you can use the dollars that are available in state government, investing in education is the one that has the longest term, highest return.
Tony Arnold is asking, how do you intend to address the budget going forward? Are you going to advocate legislators increase the flat income tax?
Well, I think you heard me talk a little bit earlier about the fact that we're going to have to make some painful cuts. And it's, this has been brought on by the failure of the fair tax amendment and the people who opposed it for their own selfish interests. I will say that from the beginning I've told people what the options are, and I talked about them again today, but we need to look at those options and decide what it is that we want to do in order to deal with this. I put forward what I think is the best idea for protecting working families while taking care of the structural deficit.
Dave Dahl, WTAX, will the sort of end of the election change the attention or focus the public will place on the coronavirus pandemic?
Will the end of the election increase attention, I guess, is the implication here? I mean, look, I don't know that anybody wakes up in the morning and isn't thinking about what's going on with the virus. I'm certainly not somebody who's had his attention taken away from it. Perhaps, but I do think that people understand that, if you're putting on a mask every day, you remember that COVID is all about us.
With voters turning down the fair tax amendment, what does it tell you about their trust in state government?
Well, as I said a little bit earlier, I think there is a significant lack of trust in government in general. And I think there are things that we need to do, and I've put forward a plan to address the failure of ethics for the state, and making sure that we have an ethics package that will really reform state government, and I'm hoping that the legislature will take that up. I know that there are quite a number of legislators who agree with me and know where I stand, and they've taken up my ideas.
Mark Maxwell is asking, won't raising taxes and making deep cuts during a pandemic and recession make it harder to win re-election?
Well, what I'm focused on is the long-term health of the state, honestly, and I'm not talking about physical health here. I'm talking about our fiscal health. we have to address this. It's the most important thing we can do, certainly long-term, to stabilize our state. And so as I said before, we're going to have to look at some deep and painful cuts because of what the billionaires and the special interests who oppose the fair tax have done.
Kelly at Block Club, with cases continuing to climb, what interventions will the state take to stop people from gathering in groups and spreading COVID-19 among family and friends?
You've seen, what we've tried to do from an enforcement perspective, but I want to remind everybody that your local officials, and I was on the phone this morning with a number of mayors from really across the region, and they understand, I think, where I stand, which is they need to take some of the hard choices. They need to do the right thing. They need to make sure that we're keeping people safe, and sometimes that means doing things that are hard. It sometimes means doing some things that are unpopular. But the fact is that we need to keep our residents of our state safe, and that means that, asking people to wear a mask is the right thing to do, and making sure that bars and restaurants, which when we have very high rates of positivity, are significant spreading locations, that we bring the positivity rate down before we reopen indoor service where it is more risky.
Ryan Boyles at Health News is asking, how do you plan to make cuts to human services while ensuring access to behavioral and substance use disorder services that advocates say are needed now more than ever due to the COVID-19 pandemic?
Well, I think we should just put a pin in everything that was in that question because, frankly, that is an excellent question that the opponents of the fair tax obviously didn't consider. And so these are decisions that will have to be made. The Republicans stood against this. This is, whatever happens here, the pain that is endured by the people of Illinois, by the working families of Illinois, is on the Republicans and the special interests and the billionaires that back the Republicans. They've got to step forward and help.
Jake Griffin at the Daily Herald for Dr. Ezike. Several county health departments have stopped reporting daily COVID data, blaming the stoppage on a data processing issue at IDPH. Can you explain what the problem is and when you expect to have the issue rectified?
Yeah, I think this might be a late issue. I mean, we have to recognize the amount of data that's coming in from all across the state into our data warehouse. And so, again, for a test that we did not even have a year ago, and now up to 90,000, almost 100,000 test results coming in. So I know we get the data, and then sometimes to be able to divide it out and push it out, there are some delays. Sometimes there are some backlogs or some processing issues. I think we are working with a contractor to smooth out those issues. I don't know that there's a current backlog right now. I think we've had them fixed, but we're staying on top of it to identify backlogs as they happen to make sure we turn that around quickly.
Rich Miller has...
And I just want to add one thing, which is, there are jurisdictions, though, that haven't submitted data. And, we don't know exactly what the reason is, but it makes it more challenging when people are not submitting their data. They have access to Salesforce and are not doing. I know the city of Chicago, the CDPH, has that problem, and we've encouraged them to please submit their data on a timely basis. And they're not the only ones. There are 97 local public health departments, and some of them are more sophisticated, more technically proficient than others. But there, to the extent there is missing data, some of that is because of a failure to submit the data.
Rich Miller has a question for Dr. Ezike. Do you expect Region 1 to enter Tier 3 mitigation soon?
I don't think it's as significant what tier it is. The goal is to turn the positivity around, to decrease the amount of disease in the community, to decrease the number of people that are in the hospital, and ultimately the number of people that die in Region 1. So whatever steps or strategies or mitigation measures that need to be taken to do that, that's what we're looking to do. Again, there's only so much that can be done from the state level. I've been talking with leaders all weekend long. Things need to be done, county by county. People should be stepping up and saying, this is what we need to do in our county to keep our people safe. They will know better what needs to be done, what can be done, and they need to start. We are going to obviously be paying attention and see what we can do, but I think what we will do will be more on the outskirts compared to what local leaders, local public health leaders, local officials can do within their own realm. And I think that's what they've been wanting, is the opportunity to do what they need to do for their people, and I think this is the time.
Yvette Shields at Bonfire will be our last question. Is a general tax hike also on the table, and how much does the state intend to borrow through the Fed's municipal liquidity facility now? And how important is it to you to preserve the state's investment grade ratings?
Very important. As you know, for 2 years, I mean, from the very beginning, the structural changes that I've been looking to put in are really aimed at putting us on firm fiscal footing and making sure that we don't trip over bond rating agencies and, having our state's credit lowered. Remember, my predecessor brought on 8 credit downgrades, 8 in 4 years. We've been in office 2 years. Before coronavirus came along, we had at least moved the needle from negative to stable, and we're on our way in the right direction. Having said that, and the question about revenue, I think that we're going to do what it takes here to balance our budget and to begin the journey here of fixing the structural problems of the state. I won't rest until that happens. It's why I believe so vigorously in the fair tax, and it's also why I believe that that we're going to work at this every day. I've already begun talking to legislators. We have to get some consensus here and make sure that we take all the options that are available and put them on the table and get to where we need to get to. Just lastly, you heard me talk about the painful cuts. Look, I've first and foremost focused on where we can trim our budget, where we can make cuts that won't be painful for working families. You want to start with those. And we're going to do everything we can, but there is a point at which there's no doubt that without revenue, some of those cuts will start to hit things that do affect working families. And I don't know that anybody wants that to happen. Do we really want to cut education funding in the state? I don't think so. Do we really want to cut funding? Somebody asked a question about mental health services or about the developmentally disabled and services that are offered to them. Do we really want to cut those? I don't think so. And so, having said that, everything's on the table because the fiscal challenge of the state is a extraordinarily high priority for me, and I think all the time about our credit rating. One last thing, when I first became governor, I think you may know, Yvette, that I went to New York and I met with not only the folks who buy state bonds, but also the folks who rate our bonds. And I talked to them about what it is that I intended to do, and I have been doing that. I've been pursuing those proposals from the very beginning, and I'm going to continue on the path of getting us to fiscal responsibility and fiscal stability.
Sorry, Dan Petrella had one more. Do you think if a tax increase needs to come up, that it should come up during lame duck or veto?
Well, we have to move expeditiously, there's no doubt.
All right. Thanks, everyone.
Thank you.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.